Hello and welcome to this episode of Doctor is In. My name is Susana Guerreiro and I'm the clinical nurse coordinator of the stroke program here in Cleveland, Clinic Abu Dhabi. Today we will be debunking some common myths about stroke and that we so frequently encounter. And for that today here I have our stroke physicians. I have Dr. Syed on my right. Dr. Syed Hussain, he's a neurologist and neurointerventionalist and the chair of neurology. And on my left, Dr. Victoria Mifsud. She is a neurologist and the stroke program director here at Cleveland Clinic Abu Dhabi. We have a quite number of different myths that we want to address today, and we can't wait to speak and share to you all. So we will start with specific myths related to prevention risk factors, moving on to signs and symptoms, then medication. So we will start with prevention risk factors. Myth number 1, it is not important to treat high blood pressure. What can we say? What can we share?
Okay. Well, so unfortunately, this is something we meet every day in clinic, Patients go to the doctor and maybe they're told that they do have high blood pressure, and perhaps they might start to take the medication. But then after a month, the blood pressure comes down. And they think, oh, I'm cured, I don't need medication any longer. So there's the sub-myth to that, like once blood pressure comes down, you can stop your medication. No, it's not true, because once they stop the medication, they don't check their blood pressure again, and of course it goes up again, because this is a chronic illness. And then months, years later, they come back with a catastrophic event, heart attack, stroke, severe renal failure, whatever it is, So that is really sad. But then there's the other side of it as well. There's a second scenario. They might go to the doctor, they're told that they have high blood pressure, they need to start medication. But they're feeling fine. They feel absolutely nothing. So then they say, no, I don't need medication, I don't feel anything, I'll feel worse if I take the medication. So again, they don't take anything. And I suppose that's why, right, blood pressure is called the silent killer.
And we have to remember it's the number one modifiable risk factor all over the world. So if you evaluate your blood pressure and you treat your blood pressure, you effectively reduce your risk of early death, heart attack, stroke, and all-cause mortality. And I cannot emphasize this more, that patients really need to be proactive with this. It's not just us saying you take your medication. They should be monitoring their blood pressure and make sure it's being effectively lowered. And just as Dr. Victoria said, that it's a lifelong treatment. You need to be dedicated and following it.
So it's kind of a teamwork. Physicians and the patients itself, there's some kind of homework that they need to do in a lifelong, correct? So we all agree that it's a myth. No, it's not a myth. It is a myth. So we agree that it is a myth and the blood pressure must be treated, must be controlled in a lifelong, and the medications, they need to be taken.
Indeed.
Yes, absolutely.
Indeed.
I think from here we can move on to the myth number 2, still within the risk factors. Myth number 2, smoking shisha is not important. It's not really smoking. I've heard this several times.
It absolutely is. And I think we should dispel that once and for all. We have so many patients who come to our clinic, and when we ask them, do you smoke? They say no. And then when you further probe them, it says, yeah, I have a shisha, maybe socially or on the weekends, or maybe 3 or 4 times a week. And when you actually delve into it, they are actually smoking. And the general thought is that if you smoke one shisha pipe, that's the equivalent of smoking an entire pack of cigarettes in one setting, which is very hard to do normally for most smokers. But because shisha, the flavor and the smell is more tolerable, and usually it's done socially, there's a much higher dose that's being delivered. Shisha exactly carries the same cardiovascular risks of heart attack, stroke, and early death. And I would extend that to even these newer agents,
Exactly.
Which a lot of people believe that those are okay. Smoking is bad, but these other things are okay.
Like vaping, right?
Yeah,
exactly.
exactly.
But
Exactly. It's very common these days, especially in the younger generation. And there's a few studies coming along, and even in the social younger generations with lung diseases, neurological diseases, depression, anxiety that comes along with it.
Yes, absolutely.
So definitely smoking is a big no-no. It increases the risk of a stroke, and it does not help preventing, actually.
Absolutely.
Moving on to myth number 3. Strokes are not preventable. Kind of goes along with the myth number 2.
Well, no, exactly. So, okay, granted, there are some risk factors for stroke which are not modifiable. You know, you can't change your age, you can't change your gender, you can't change your race, some genetic factors. Yes, there are some risk factors which are not modifiable. But on top of that, there are many risk factors, some of which we've mentioned already, right, which actually are very modifiable. And controlling high blood pressure truly, as you mentioned, really is the most important modifiable risk factor. And actually stopping smoking follows it very closely. But together with that, you've got treating diabetes, making sure it's very well under control, keeping cholesterol levels at normal and sometimes even low normal levels, taking care of atrial fibrillation, which is another big risk for stroke, you know, an irregular heartbeat, which increases the risk of clots flying from the heart. But if the patient is on blood thinners, then that actually can significantly reduce the risk of stroke and prevent further strokes. And I suppose in addition to that, there could be possibly also healthy lifestyle, right?
Absolutely. So there's the medical aspect, the risk factors, managing those risk factors, but then lifestyle-wise, having an optimal weight, a healthy weight, being physically active overall, good sleep-wake balance and the quality of sleep, that's been extensively studied. And if people are overweight and they have sleep apnea, these things can weigh into it. But really, lifestyle is a huge component overall for wellness and health, but specifically also to reduce your risk of stroke. And these all fall into the realm of prevention. So, and a lot of these things are intuitive. The general public knows these things. But sometimes putting them into practice with our busy lives is hard. And it may be easier to just take a pill, but we constantly are stressing the importance of lifestyle and specifically physical activity and maintaining a healthy weight and a good diet is important.
And people just don't seem to realize that actually, if we do all of this, then actually many strokes are preventable.
Yeah.
So as much as people look for the tablets, miraculous tablets and medication, there's a lot that they can do on their own, right? With the changes of lifestyle, trying to find the root cause for some of the symptoms that they have. That nowadays we actually bring up with new studies and a lot of social around preventing certain kind of diseases. Moving from prevention and risk factors, we'll move on a little bit on how to identify signs and symptoms of a stroke. So myth number 4, if there is no weakness, if there is no numbness, that means that I don't have a stroke.
Yes, so that is not true. While those are the most common symptoms, or commonly known symptoms, I should say, because if you go weak on one side of the body or numb on one side of the body, it's very obvious to most people. But there are other symptoms of stroke. And we use the abbreviation acronym BFAST. And so B stands for balance, E is for eyes, so any problems with your balance or vision. F is for face, if you have a droopy side of your face. A is for arm or limb weakness, if you develop weakness on one side of the body. And S is for speech changes. If you feel any of these, then T, it's time to call the emergency services and get into an emergency room. And so knowing those other symptoms is important. And we can't tell you how many times we have patients, I had a dizzy spell and I decided to just sleep it off. And then unfortunately they missed that window. So recognizing these other symptoms of stroke is very important. And as we always like to talk about, time is brain. So as soon as you develop any of these symptoms, you need to seek medical attention immediately. And the quicker you get in, the greater chance we have of preventing or even reversing any type of disability.
Yeah. And in fact, I think another one that we don't often think of is that many people present with what we think is confusion, or what family thinks is confusion, right? And then actually, when a medical professional speaks to them, the person is not confused. They just cannot say the right words. They cannot speak. And this is actually a language disturbance, which is one of the S speech, in the BFAST. And that is a very important thing to be aware of as well. And maybe the other thing as well is that for all of these symptoms, of course, we're talking stroke, right? So we're talking something comes on very suddenly. We're not talking about something that has been there coming on gradually, for days and weeks,
Yeah.
So for stroke, we're talking about a very sudden and acute onset.
Due to this, we're going to move to the myth number 5. If those symptoms, weakness, paralysis, numbness, come, we can watch, wait, or sleep on it. And then people think, probably it will going to go away.
Yeah, so you already alluded to this, want to expand a little bit more, actually,
Yes.
So basically, the bottom line is this, right? In the very early hours of a stroke, especially if we're talking about a stroke caused by a clot, which is blocking an artery, we are able to give medication which can dissolve that clot. And if it dissolves the clot, then it can allow blood to perhaps reflow into the area of the brain which is not receiving the blood and not receiving oxygen or nutrients. And if we're able to do that quickly enough, then we may be able to save part of the brain before it actually dies off. So the one message that I would really want to transmit to anyone and everyone who would bother to listen to me is that stroke is actually a medical emergency. So the moment that you feel any of these symptoms and you think, oh, maybe it's a stroke, no, you don't go back to sleep and hope it goes. No, you don't massage the arm and wait. You literally call an ambulance and run straight to the nearest hospital, which is a stroke center. Hopefully not any hospital, because not everyone can deal with this. So you go to the nearest stroke center, like Cleveland, Clinic Abu Dhabi, and then, if you arrive within the first 4.5 hours, you can receive the medicine. What I mean to say is the 4.5 hours is a very short time window. It's amazing how fast time flies. 4.5 hours is not from the moment you reach the hospital. It's from the moment things start to happen. So until things start to happen, you notice, or your family notices what is happening, you call the ambulance or get into a car, you're taken to the hospital, you reach there, you're evaluated, scans happen, and then the decision is taken that you can take the medicine. Time flies. So it's essential to run immediately.
Absolutely. So the time window actually can be expanded further in that we may be able to treat patients up to 24 hours out from a stroke. And that's where a specific procedure called mechanical thrombectomy comes in. And basically what it is that if you have a larger blood vessel in the brain that is clotted off, then we can use a catheter to retrieve that clot, to reperfuse or reestablish blood flow to that side of the brain. And that is a very powerful treatment that has been shown all over the world to help improve outcomes, reduce your risk of disability and overall dependence. And so the time window for that treatment is up till 24 hours. However, again, time is brain. We don't delay the treatment. We can act up to 24 hours, but as soon as a patient comes in, we will act on it. Yes.
The earlier within the time window, right, the greater the chance of improvement.
Absolutely.
Yeah.
And better patient outcomes also.
Okay.
Time is brain, as Dr. Syed just mentioned. So stroke must be treated as an emergency, just like you will treat a heart attack.
Absolutely.
Exactly. It's a brain attack, right?
So this brings us to myth number 6. If symptoms go away, there's nothing to worry about.
No, Absolutely, there is something to worry about, and you need to get into the hospital immediately. So some patients will have a warning attack or an episode where they transiently have symptoms and the symptoms resolve. And again, it's not uncommon that people will just shake it off. Oh, I probably didn't drink enough water today, or I worked too hard, or I've been under stress. I'll just go lie down and things will be okay. No. If you have any symptoms suggestive of a stroke, again, remember, be fast. And even if the symptoms go away, that could be a warning of a stroke that is about to come. And in our terms, we call that the TIA, or a transient ischemic attack, which basically means temporarily the blood flow to the brain has been impaired. And maybe you have recovered, but there's a sign that it could happen again. And actually, when we look at clinical data from a lot of research, when we look back, up to a third of patients may have had a warning attack before they finally have a stroke in the 2 weeks before they came in. And so this is not uncommon for us, that we see patients that when we quiz them and we inquire, they said, you know what, last week I felt the exact same thing, but I didn't think much of it. And so the take-home message is, even if you have symptoms for a short while, that's a window of opportunity. You need to come in.
Exactly. And we do know that actually the highest risk of having a stroke after TIA is actually within the first 24 hours and also within the first month. So it's really a window of opportunity that you can potentially prevent something with permanent disability. So it's essential to act immediately, as you said.
The community cannot minimize their symptoms, just thinking that they will go and nothing else will happen. Definitely, if they experience any of the symptoms mentioned, they should seek for help immediately.
And as an emergency as well.
Yeah.
You know, it's not like, oh, maybe I'll go to my doctor next week. No, go immediately, and because you don't know when the next one might happen.
Very well. Let's change track to treatment. Let's start with medication. Myth number 7. When we are looking into a little bit of change in the track of our conversation, medication after a stroke consists of a course of treatment, or what do people would think, right? Because we have something here that we can...
There are so many misconceptions about this, you know. So people... Obviously, in hospital, when they leave the hospital, they leave with their little packet of medications, you know, and there'll be something to prevent clotting, most often something like aspirin or something similar. Or sometimes perhaps they might have an actual blood thinner. Then in addition, they'll probably have something to treat their blood pressure, or if they're diabetic, there'll be something to treat their diabetes. And most people will have something for cholesterol as well. Tailored always to whatever the patient requires. So they leave with their medication, they probably take it, and then it runs out. And some people realize that they need to continue taking it, but it happens so often in clinic that you see the patient in their follow-up, and you say, okay, so, you know, what medication are you taking? Oh, nothing. My course is over. I finished everything. And you're like, no, this is not a course. This is lifelong therapy. It's a bit like we said at the very beginning, right? You stop the medication. It's a chronic disease. Things will just happen again.
And then they finish the course, they're feeling well, and then, oh, I'm good, right?
Absolutely. And I think that's where the concept of prevention is important. Just a couple of days ago, I had a patient who came in who did exactly this and stopped everything. And obviously there are a lot of myths and conspiracy theories out there about, oh, you shouldn't be taking this type of medicine or that type of medicine, and medicines have side effects. And what I tell my patients is that I'm very happy that you're recovering from your stroke, or you've recovered from your stroke, but you need to understand that you have a risk of another stroke or even a heart attack. And that is maximal actually within the first 2 years. So while you may have a personal goal that you want to come off these medications, let's really work in this high risk period right now. Let's take your medicines. You can work on your lifestyle. If you want to quit smoking, you can manage your diet, lose some weight, do all of those things. But right now is the high risk period. And let's be aggressive with treating this, because we prefer preventing strokes rather than treating strokes. And I think that's the key message, that yes, we can prevent strokes, but that's where it's a partnership. The patients need to take ownership. They need to recognize that right now they're in this risk period where we're modifying their risk with medications. They can do the lifestyle component, but this is a high-risk period, and taking these medications are vital, very important.
And also following the recommendations of the physicians, not the friend that knows something that took the medication that worked for him. What works for others, recommended by their physicians, eventually probably it will not going to work for you, because there are so many things that needs to be considered, and our medical team well capable of doing these recommendations. So people should be aware that there is a recommendation from professionals that should be followed, right?
Yeah.
Absolutely, absolutely.
Myth number 8. I really like this one. Strokes only occur in the elderly.
Yes, so while that's common, and as Dr. Victoria alluded to, that age is a non-modifiable risk factor, so as patients get older, you know, the risk of stroke after the age of 60 is higher. But stroke can happen at any age, and I think that's the take-home message here. Actually, in our hospital, up to about 25% of our patients are less than the age of 40 when they have a stroke. And it's important to understand that stroke can happen at any age, and it's not necessarily, oh, this can never happen to me, and I don't need to worry about stroke. It can happen at any age, and you may have specific risk factors that increase the risk at certain age groups. And so the recognition and early treatment and prevention applies at any age group. And the quicker symptoms are recognized, the earlier they come in, the more likely we are to help reverse or manage any disability and prevent future strokes.
Exactly. And that's exactly why it's so important, right, for everybody to be aware of the BFAST acronym.
Yes.
Because you want everyone to recognize a problem at any age and in any circumstance.
So we need to remember that as much the strokes can occur in different ages. Even younger age, completely healthy, but by any chance has an event and suddenly has a severe headache, or one of the right arm or right leg will not going to be very functional. There's a deficit in mobility. All of these symptoms, regardless of the age, they should seek the medical assistance. We need to remember that they can occur in any age, gender. So as soon as we have one of these positive items of the BFAST, they should be able to call for help.
Absolutely.
Indeed.
Any other thing that you like to add? We're about to finish. We're good.
I will just repeat over and over, stroke is a medical emergency, act immediately. That for me is the biggest take-home message.
Yeah.
And time is brain. The quicker you get in, soon as you recognize any symptoms in yourself or a loved one, or if you're standing by and you see somebody develop any of these symptoms, recognize it and call it in. Call an ambulance, get in, because time is brain.
That's
Indeed.
great. Thank you so much.
Thank you.
So thank you to both Dr. Syed and Dr.
Thank you.
Victoria for being here and for running through this myth surrounding stroke. We hope that this has helped to dispel these misconceptions and to make things clearer for our viewers. In case of stroke, be sure to run to the nearest stroke center. Cleveland Clinic Abu Dhabi is a designated stroke center of excellence, and we are available for 24 hours, 7 days a week to treat any stroke patients. Thanks for watching, and until next time.
Thank
Thank
you.
you.
Bye.
Bye.